Hey guys, I hope everybody is doing well. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We're going to go over, is heat or ice better for back pain? So generally, I know people think they can really hurt themselves if they apply heat or ice incorrectly, and that's kind of a misnomer. It is not something that you can truly do a lot of damage with if you put the wrong thing on. So I don't want to scare anybody into thinking that there's really one correct answer. And I know if you look online, there's several things you can find that says never use heat, never use ice, but that's really not the case. Generally, you only are going to keep it on for 15 minutes. So in that period of time, you're not going to do a ton of damage. So don't not use heat or ice because you're afraid of using the wrong one. Either one can generally help you in any situation you're in. But talking about back pain, and there's two different types of back pain that we're going to talk about. We're going to talk about what we call acute back pain and chronic back pain. So acute back pain is when you go to bend down and pick something up and you have a sharp stabbing pain, or you get out of bed and your back goes into spasms. It is a pain that you know exactly when it started, and it is severe. So it is not something that is lingering. It is not something that is occurring every day. It is a stop you in your tracks, this really hurts type of pain. I may go see a doctor, or there's something wrong with my back. That's what we call acute back pain. So that is when you're going to want to put ice on there. So just lay down, put some ice on there, stop what you're doing, try to minimize any sort of lifting with your back or any sort of twisting with your back. That's going to exacerbate that acute back pain. But you want to stop and you want to put ice on it. Again, about 10 or 15 minutes. Whenever you're applying heat or ice, you really want to try and have a layer of either clothing there, or maybe you put a towel over the ice pack, but just something to make sure that it's not really directly on the skin. You can give yourself ice burns or heat burns, and that's what you do want to avoid. So if you have that acute pain, again, that's that stabbing, that's that immediate pain, you just felt it, usually like a 24-hour, 48-hour window, that is that acute pain. That's when you want to stop and say, okay, let me get some ice on there. What you don't want to do though is after the ice, you don't want to just lay around. It's really important that even with acute pain that you gently move and you go and consult your physical therapist. And if you are in acute back pain and you want a free consultation with the doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. But you want to make sure that you address that. The more you take Advil, the more you put on ice, the longer it's going to take to heal, believe it or not, because it will reoccur because you didn't treat it. You didn't really figure out why it happened. You didn't figure out if the muscle is already upset and it just went into spasm. Generally, muscle spasms are something that build up over time, even though they may occur suddenly or with one specific movement. It's been building up over time. So a little bit of ice and some Advil isn't really going to fix anything. It may take the edge off, but it's going to take it a lot longer for you to heal. One of the biggest things we hear in physical therapy is, I wish it didn't take so long. And to that, I always say, I wish I'd gotten here the 6 months prior when it actually started to hurt. Then it doesn't take as long as when you wait 6 months or a year. I mean, we hear so many stories of my back's been killing me for the last 3 years. That pain's not going to go away in a month. We have to reverse everything that you've been doing for those 3 years. So that acute back pain, you want to get ice on it, and you want to make sure that you definitely consult somebody as to why that happened, because this is the best time to actually deal with it, is when it is acute. It's when we can get it taken care of quickly. Then we have when you should use heat. So this is more of a chronic back pain situation. This is more of a, I woke up stiff. If you're someone who wakes up with a stiff lower back, or you like a hot shower, that's when you use heat. It's important that you make sure that you are, that your back is just more stiff. And that's the best way I could describe when you should use heat, is when you really need to loosen up. You're not in that stabbing acute pain that may be on top of it, but this is like you worked all day, you were able to go through a whole day of work, but that nagging ache, that pain is still there. It's not something that all of a sudden escalated and you're in severe pain right now. It is something that, it's still there. It's been going on for a while. maybe you're gonna go get a massage, maybe you're going to physical therapy, but you wanna make sure that you're loosening up that muscle. And again, when you lay on heat, you don't wanna just lay on heat, take it off, and then lay there. Super important to make sure that you're following that up with either stretches or strengthening activities, or you're at your physical therapy office. It's something that you don't just want to do in and of itself. It's not a treatment. So a lot of times people say heat doesn't work. You're right, it's not going to solve everything. But if you are doing heat and then doing some stretches that can actually help the increase of blood flow to the area and help you stretch a little bit easier. And sometimes it's just more of a psychological thing where it makes you feel looser, and that works too. But the heat is reserved for those chronic conditions, those things, those nagging, lingering aches and pains that don't really go away, maybe over time, maybe you felt it before, but that's when you apply heat. So those are just some quick tips on when to apply heat or ice when you have back pain. If you or someone you know is suffering with back pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898. We'd be happy to get you in. Thanks and have a good night.